cardiac surgeon warns this sleeping position raises stroke risk overnight. Senior health tips. For 40 years, a widespread deception has been subtly influencing the health and well-being of seniors, a deception that, alarmingly, could pose a fatal threat during sleep. Dr. Leonard Javier, a cardiac surgeon, is stepping forward to reveal critical information that could be life-saving before morning. The focus is on a common nighttime habit, engaged in by an astonishing 89% of seniors over the age of 60, a habit that silently primes the body for heart attacks between the vulnerable hours of 2 a.m. and 6 a.m. This is a period when our bodies are naturally most susceptible, and unsuspecting individuals are unknowingly placing themselves at grave risk. The gravity of this situation was starkly illuminated in 2019 when an internal document leaked from a major American pharmaceutical company exposed a deeply disturbing truth. Their own researchers had meticulously documented a direct correlation between this prevalent nighttime habit and an overwhelming number of annual heart attack fatalities among seniors, a staggering 340,000 deaths each year. This translates to an unacceptable 932 preventable deaths on a daily basis. Instead of issuing public warnings and prioritizing patient safety, the company chose to suppress this vital information. The motivation behind this suppression is chillingly clear. The treatment of heart attacks generates an annual revenue of $89 billion, a figure far more attractive than the preventive measures that would diminish this lucrative market. Dr. Javier is committed to exposing this deliberate obfuscation, unveiling the 7 specific nighttime habits that trigger heart attacks while one is asleep, and providing simple, actionable changes that clinical studies have shown can reduce overnight heart attack risk by an impressive 67%. However, he emphasizes that this information may contradict conventional advice from cardiologists, not due to its ineffectiveness, but because of decades of strategic suppression by the pharmaceutical industry. Dr. Javier underscores the importance of a genuine commitment to health. He urges viewers who believe seniors deserve unfiltered truth about heart health, rather than information that primarily benefits pharmaceutical companies, to subscribe to his channel and activate notifications. He states that only those who profit from widespread suffering would shy away from such a call. For pharmaceutical employees attempting to suppress this knowledge, he makes it clear this message is not for them. However, for seniors who are weary of misinformation, tired of polypharmacy with its attendant side effects, and no longer wish to live in fear of a sudden, life-ending chest pain, subscribing is a powerful act of defiance. He encourages viewers to share their age and location in the comments, acknowledging that pharmaceutical companies are actively monitoring this discourse. And by speaking up, we can collectively demonstrate our refusal to be silenced. The first critical habit Dr. Javier addresses is habit number 7, taking blood pressure medication at the incorrect time of day. A vast majority of seniors, specifically 74% of those over 65, are prescribed blood pressure medication and, as per standard advice, likely take it in the morning with breakfast. This is the universally accepted practice, reinforced by doctors' instructions and prescription labels. However, Dr. Javier asserts this timing is actively contributing to preventable deaths. The crucial, often undisclosed fact is that blood pressure follows a natural 24-hour cycle, characterized by a dip during sleep and a significant surge between 3 a.m. and 6 a.m. This early morning rise is driven by the body's release of stress hormones like cortisol, intended to facilitate waking. In healthy individuals, this surge is manageable, but in seniors with hypertension, particularly those over 70, this surge can escalate into a dangerous spike, capable of rupturing weakened arterial walls, dislodging existing blood clots, and triggering massive heart attacks while the individual is completely unconscious and defenseless. The problem with morning medication is that its effects wane considerably by midnight and are often completely out of the system by 2 a.m., precisely when the most perilous window for heart attacks begins. This leaves individuals unprotected during the hours of highest risk. The efficacy of altering medication timing is powerfully demonstrated by a 2022 study published in the prestigious European Heart Journal. This extensive trial followed 19,084 adults with hypertension for over 6 years. Participants were divided into 2 groups. One group continued their usual morning medication regimen, while the other took the exact same medications and dosages, but at bedtime. The results were nothing short of astonishing. The group that took their medication at bedtime experienced a remarkable 45% reduction in cardiovascular events, including heart attacks and strokes, and their risk of dying from cardiovascular causes plummeted by an extraordinary 66%. The study confirmed that the early morning blood pressure spike, the most dangerous period, was effectively controlled in the bedtime group, whereas the morning group remained vulnerable. A 66% reduction in mortality achieved simply by changing the timing of medication intake should have been headline news. Every cardiologist should have alerted their patients, and regulatory bodies like the FDA should have mandated label changes. Yet, this did not happen. The reason is simple. There is no financial incentive in recommending the same medication at a different time. Such a recommendation cannot be patented, cannot command a higher price, and does not generate a new product line. Consequently, this groundbreaking information languished in a medical journal, accessible to a mere 0.2% of the patient population. Dr. Javier then introduces the poignant case of George, a 73-year-old retired postal worker from Nevada. George was a robust individual who maintained a daily 3-mile walk and diligently took his blood pressure medication precisely at 7 a.m. after breakfast for 12 years. Tragically, one Tuesday morning, his wife discovered him unresponsive in bed at 5:30 a.m. He had suffered a massive heart attack around 4 a.m. Despite swift medical attention, the damage was too extensive. George survived but was left with significant disability, now reliant on a walker and unable to climb stairs or drive. His cardiologist attributed the event to "these things happen" and the natural giving out of an aging heart. However, upon reviewing George's case, Dr. Javier identified a critical oversight. George's medication was effective for daytime blood pressure control, but his 24-hour monitoring revealed severe early morning spikes, with readings reaching 180, 110 between 3 a.m. and 6 a.m., a clear indication that his medication had worn off. His heart was critically unprotected during the most dangerous hours, and neither his primary physician, his cardiologist, nor his pharmacist had ever suggested that a bedtime dosage might have been life-saving. Dr. Javier unequivocally labels this as medical negligence, a situation that is currently impacting millions of seniors. He strongly advises, however, that any change in medication schedule must be discussed with and supervised by a doctor. If a doctor dismisses the idea of bedtime dosing, he urges patients to present the European Heart Journal study, known as the Hygia chronotherapy trial, emphasizing that it is not fringe science but robust peer-reviewed research. If a doctor still refuses to consider such evidence, Dr. Javier suggests seeking a new physician, as a practitioner who ignores such compelling data is effectively acting as a pharmaceutical sales representative rather than a medical professional. Moving on, Dr. Javier addresses habit number 6, an activity so commonplace that 93% of seniors engage in it daily, and which is actively destroying arteries and significantly increasing heart attack risk. This habit involves prolonged sitting in the evening before bed. He paints a familiar picture: 6 p.m., dinner concluded, settling into a recliner for several hours of television or other sedentary activities until bedtime. This prolonged immobility leads to a dramatic slowing of blood flow by as much as 50% in the legs, a condition known as venous stasis. This sluggish blood flow is a primary trigger for blood clot formation. While the body typically dissolves small clots, in seniors, especially those with pre-existing cardiovascular conditions, diabetes, or on certain medications, these clots may not dissolve and can grow slowly. When an individual finally stands up, blood pressure shifts, and these dislodged clots can travel to the heart, blocking arteries or triggering arrhythmias that lead to heart attacks, all this occurring unbeknownst to the individual. Research from the American Heart Association, analyzing over 8,000 adults over 45, revealed that sitting for more than 10 hours daily was associated with a 34% higher risk of heart attack and stroke. Crucially, it was not the total sitting time, but the uninterrupted sitting time that posed the greatest danger. 4 consecutive hours of sitting before bed were found to be significantly more hazardous than 6 hours broken up with short breaks every 30 minutes. Even brief moments of movement, such as standing up or walking, can restore blood flow and prevent clot formation. Unfortunately, many seniors, while watching television in the evening, remain motionless, inadvertently increasing microclot formation by 2.3% with every minute of inactivity. Over years, this habit transforms restful evenings into a buildup of arterial plaques and clots. The case of Patricia, a 71-year-old grandmother from Ohio, vividly illustrates this danger. Her routine of dinner at 6 p.m., followed by 4 hours of uninterrupted television until 10:30 p.m., led to a life-threatening event. Despite her morning walks and exercise classes, she collapsed 3 steps from her bedroom, experiencing crushing chest pain. An ambulance arrived quickly, and at the hospital, a massive clot was discovered in her left anterior descending artery, a vessel often called the widowmaker. The clot had formed in her legs during her prolonged TV session and traveled to her heart when she stood. Patricia survived, but the incident was entirely preventable. A simple act of standing up for 60 seconds every 30 minutes during her TV time could have restored blood flow and prevented the clot, yet her doctor never mentioned this risk, as there's no billing code for advising patients to stand during commercials and no pharmaceutical profit in recommending simple movement. Dr. Javier's advice is to set a timer for every 30 minutes during the evening routine and simply stand up, walk around, or do anything to get blood moving. Even shifting position or flexing ankles can help if standing is difficult. Breaking up prolonged sitting is key, with a recommended pattern of movement breaks every hour. This practice reduces venous stasis, keeps blood flowing, prevents clot formation, and can decrease overnight heart attack risk by 41%, all at no cost and with 0 side effects. Habit number 5 is equally detrimental and involves consuming high-sodium meals within 3 hours of bedtime. Many processed, canned, or takeout foods contain alarmingly high levels of sodium, often exceeding daily recommendations in a single meal. Consuming such meals in the evening triggers an immediate increase in blood volume due to sodium's water-retaining properties. This excess fluid elevates blood pressure, and when one lies down, this fluid shifts, pooling around the heart. The heart is then forced to work harder against increased pressure, especially during the critical 2 a.m. to 4 a.m. window when heart attacks are most common. A study in the Journal of the American Heart Association highlighted that individuals consuming more than 500 milliliters of sodium within 3 hours of bedtime experienced significantly higher blood pressure during sleep, a greater rate of nocturnal hypertensive episodes, and a more than 3-fold increase in early morning cardiovascular events. Crucially, this effect is exacerbated in seniors over 65, whose kidneys process sodium much more slowly, meaning the sodium consumed in the evening remains in their system during the natural early morning blood pressure surge, creating a dangerous double spike. The deception is further compounded by the food industry, which designs products to be high in sodium, exploiting its addictive properties to encourage repeat consumption. Products often labeled heart-healthy due to low fat content can be laden with sodium, with minimal warnings on packaging. This leads to seniors unknowingly consuming a sodium time bomb that can rupture arterial walls or dislodge clots during sleep. The story of Robert, a 69-year-old retired contractor who consumed 2 healthy, choice frozen dinners dinners, each containing nearly 1,000 milliliters of sodium, illustrates this tragedy. His medication-controlled blood pressure spiked dangerously high during sleep, leading to a fatal rupture of his left anterior descending artery. Dr. Javier's recommendations are clear. Limit sodium intake to 500 milligrams after 5 p.m. Consume high-sodium foods at lunch. Prioritize fresh, unprocessed foods for evening meals, and meticulously read food labels. Drinking extra water in the evening can help flush sodium, but intake should cease 90 minutes before bed to avoid sleep disruption. Habit number 4 involves a seemingly innocuous bedtime snack that, when combined with alcohol or sleep medications, can lead to fatal arrhythmias. The combination of alcohol and sleep medications is particularly dangerous. Alcohol acts as a cardiovascular depressant, but its rebound effect later in the night can cause significant surges in heart rate and blood pressure. When combined with sleep medications that suppress the brain's ability to regulate heart rhythm, the result can be sudden cardiac death. A study in the European Journal of Preventive Cardiology revealed that combining sleep medications with regular alcohol consumption dramatically increased cardiovascular mortality, with risk escalating exponentially with increased alcohol intake. These deaths often occurred during sleep from cardiac arrhythmias that never wake the victim. Pharmaceutical companies are aware of these risks but bury warnings in obscure package inserts, and doctors, pressed for time, may not fully explain the dangers. Margaret, a 74-year-old, exemplifies this peril. Her routine of dinner with wine followed by her usual Ambien dosage led to her death from arrhythmia. The medical examiner noted the presence of alcohol and Ambien, but deemed it an unfortunate but unforeseeable interaction. Dr. Javier emphasizes that such interactions are documented and foreseeable. He advises strict avoidance of alcohol on nights when sleep medication is taken, or a minimum of 8 hours between alcohol consumption and sleep medication. For those dependent on both, professional help is essential. Habit number 3 is going to bed dehydrated, a common occurrence among seniors who restrict fluids to avoid nighttime bathroom visits. Dehydration thickens the blood, making it harder for the heart to pump and increasing the risk of clot formation, especially during the early morning blood pressure surge. A study in the American Journal of Epidemiology showed a significantly higher risk of heart attack, stroke, and cardiovascular mortality in dehydrated individuals. The diminishing sense of thirst and reduced kidney efficiency in seniors exacerbate this issue. Tragically, medications prescribed to reduce nocturia can further worsen dehydration, creating a vicious cycle. Dr. Javier advocates for a structured hydration protocol, ample water in the morning and throughout the day with limited intake after 6 p.m. and a small amount 90 minutes before bed to ensure hydration without necessitating frequent nighttime urination. Habit number 2, a sleeping position that 71% of seniors adopt, restricts blood flow to the brain and heart for extended periods. Sleeping on the right side or stomach compresses vital blood vessels. Right side sleeping compresses the heart and the inferior vena cava, increasing cardiac workload by an estimated 23%. Stomach sleeping twists the neck, severely reducing blood flow to the brain. A study in the Journal of Clinical Sleep Medicine linked these positions to higher rates of nocturnal cardiac arrhythmias, angina, blood pressure elevation, and even mini-strokes during sleep. Left side sleeping, conversely, promotes better cardiac output, more stable blood pressure, and improved lymphatic drainage due to anatomical positioning and gravity. David, a 68-year-old postal worker, suffered a severe stroke due to years of stomach sleeping, which had compromised blood flow to his brain. His chronic morning headaches and dizziness were ignored as mere side effects of allergies or mild sleep apnea, while the critical factor of his sleeping position went unaddressed. Dr. Javier strongly advises sleeping on the left side, using a body pillow to maintain position. If left side sleeping is impossible, sleeping on the back with head elevation is a safer alternative. Stomach sleeping is strictly forbidden after age 60. Finally, habit number 1, the single most dangerous thing seniors do before bed is taking certain medications that should never be taken before sleep. This includes first-generation antihistamines like diphenhydramine, certain antidepressants, some blood pressure medications, and specific painkillers, particularly those with anticholinergic effects. These medications interfere with the body's natural regulation of heart rate and rhythm, especially during sleep when compensatory mechanisms are reduced. This can lead to fatal arrhythmias during the early morning stress hormone surge. A study in JAMA Internal Medicine revealed that 58% of sudden cardiac deaths in seniors were linked to anticholinergic medications taken within hours of death, with the highest risk occurring during sleep. Many of these dangerous medications are available over the counter, with warnings so buried they are effectively invisible. Dr. Javier shares his personal tragedy of losing his uncle, Richard, to a combination of sleep-inducing antidepressant and blood pressure medication, both taken at bedtime. He urges viewers to audit all medications, identify those with anticholinergic effects, and consult their doctor immediately about switching timing or to safer alternatives like low-dose melatonin or magnesium glycinate. The 7 habits, medication timing, evening sitting, high-sodium dinners, alcohol with sleep aids, dehydration, sleep position, and dangerous bedtime medications, are not random occurrences, but the result of a medical system prioritizing profit over prevention and education. Dr. Javier presents viewers with a choice: continue in ignorance and risk succumbing to preventable causes of death, or take control by implementing these life-saving changes. He implores viewers to subscribe, like, share, and comment to help spread this critical information and combat the deliberate suppression by the pharmaceutical industry. He promises to continue exposing these lies and empowering seniors to reclaim their health and autonomy. The subsequent video will delve into breakfast foods that trigger strokes, further highlighting the hidden dangers in everyday senior diets. By understanding and acting upon this knowledge, seniors can protect their hearts, extend their lives, and ensure a healthier future.